It's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Hello, welcome back to this week's episode of Back to the Basics. Thank you for joining me. You are in for a treat this week. So I have my really good friend and super smart woman, Erin Files. She is a nurse practitioner in Edmond, Oklahoma. So I met her actually at a conference in Texas back in May, but she actually practices here in Oklahoma City, and she does a lot of the same stuff that I do. I know you guys are really interested. A lot of you have reached out, love the gut health stuff and just the functional aspect of what we're doing at Modern Endocrine. So I wanted Erin to come on because she has actually been doing this for 12 years, you guys. So she is a family practice nurse practitioner. She's had her own practice, Encompass Wellness, for the last 10 years. But she's been doing bioidentical hormones in pellet form and just bioidentical hormones in general for the last 12 years. She does gut health. She does organic acid testing. She does heavy metal testing. And she also does aesthetics. And she does aesthetics in a way that I really like. She's got this new procedure where she does aesthetics for people with autoimmune conditions like myself. So you guys know how I feel about filler in my face and how I don't want to put it under my eyes and things like that. So Erin has a solution for that for us. So I'm super excited to have her on Back to the Basics podcast.
Hi, everyone. How are you?
So I usually have people start, Erin, with just like, give everyone like a little spiel about how you got to where you were. Like, I guess, why did you want to do medicine? And then how did you end up in like the functional medicine space?
What made me want to go into medicine is, without going real in depth, my childhood, my dad passed away whenever I was 10, from what I would say was really poor clinical judgment. He was 38 years old, had multiple trips to the emergency room for what was thought to be acid reflux and was undiagnosed heart attacks. And that was what led to me deciding I wanted to get into medicine and do things a little bit differently. But even, then that was over 20 years later when I started studying medicine. And during school, I spent so much time learning about diseases and drugs and very little time learning about diseases and what causes them. And so whenever I finished nurse practitioner school, I decided I wanted to figure out a way to do things differently. And at that time, 12 years ago seems like a long time ago, but it seems like yesterday. There weren't a lot of practitioners here in Oklahoma or even programs in which I could figure out how to do that. And so I kind of stumbled onto a course for hormones by the American Academy of Anti-Aging Medicine and thought, that's a good way to start looking at, kind of the way I want to approach medicine. And then through that led to one thing to another. You quickly realize when it comes to hormonal health, especially with women, that so much in regard to hormonal imbalance really comes down to inflammation, poor gut health, genetic mutations, those things. And so the A4M courses led me to IFM courses, which is the Institute of Functional Medicine. And at that time, those two were very separate in their approach. One was kind of promoting purely hormonal balance, and the other was more along the lines of things like organic acid testing, looking at chemistry and pathophysiology. And over the years, those two approaches have to some degree joined because, everyone in this field has kind of realized that they're one and the same. So I opened my own practice 10 years ago to be able to treat people, root cause, top to bottom. And that's, again, where the aesthetics came in, because so many patients also, after feeling good, they want to look good, but they're a little timid about how to go about that. So we try to do all of it here. So.
Okay. So what does so you kind of came about the same way as me, sort of a personal health journey, although it was through your dad. And so you've been doing it for a really long time. And do you find it, the other thing I would like, we have a lot of providers that listen to this podcast as well. And so I try to emphasize to them, it's a different type of reward whenever you take care of people and you fix them functionally and holistically versus you give them pills and let them come back and keep complaining. So would you agree with that? Like, you feel like people when you actually fix them, not only do they feel better, do you change their life, but they love you and they send all their family members to you, right?
Absolutely. Well, I mean, I think if you ask people, and I think this is so funny because people will ask me, I mean, I've had two people message me today and say, what's functional medicine? And I say, well, it's when you try to get to the root cause of a problem versus treating it with a drug or, a procedure. And they're like, well, isn't that what medicine's supposed to be? And the answer is yes, that is what medicine's supposed to be. But that, unfortunately, for lots of reasons, is not really what it is anymore. And so, when you can have somebody come in and they have goals to be healthy, because I do always tell people, I'm going to meet you where you're at. If you don't want to change your lifestyle, then this is probably not the right place for you. We'll be very frustrated with each other throughout this journey. But when people truly want to be healthy, we tend to forget in medicine that they don't really understand how to make that happen. Not everybody understands human physiology or pathophysiology. And it's our job as healthcare professionals to educate them and give them the tools that they need to get healthier. So people do love you when you help them with that.
Yeah. And when you try not to just, cram pills down their throat or, give them other things that can cause symptoms. And when you actually listen to them and actually use your brain, right? Not just A plus B is C, but think outside the box. I just saw a lady an hour and a half ago who, somebody said she's got EDS, she's got POTS, she's got mast cell activation, she's got Hashimoto's, she's got all these things, she hasn't been able to work for forever. And then it's everyone just says, oh, we'll just keep giving her drugs. So they had her on Cymbalta, and then she started having terrible symptoms from Cymbalta, right? She could barely move. She's having all this terrible pain, which is why they put her on it. And nobody has ever talked to this lady ever about what do you eat? Let's look at your gut. She's like, I don't poop for a week at a time. That's not normal, people. Nobody has ever talked to her about anything other than giving her pills. She comes in with 30 pills. And obviously she has an autoimmune issue, right? Every autoimmune thing in her body is screaming. Her vagus nerve is mad. Her gut is everything is mad. And so, she's like, I'm really happy that I found you. I'm hoping that we can figure something out. And I'm like, well, of course we can. First, we've got to get you off of this arsenal of drugs that you're on, right? Because right. God only knows what symptoms the drugs are causing. This poor lady started with one diagnosis and then got all these medicines. And then she keeps getting additional diagnoses. And it's possible that all these medicines are just causing all these other symptoms that they are assuming are diagnoses, right?
Absolutely. I cannot tell you, I've even had this happen, which broke my heart with a breast cancer patient. When people come in and they have this long list of symptoms and they'll go through, all these horrible, hot flashes, night sweats, all these things that I'm like, oh my gosh, you're a cancer patient and we may not be able to address this right now in this way. And then I look at their medication list and I'm like, or let's just stop these 10 medicines that you've been placed on, come back in 2 weeks and we'll see what happens. And they're like, I'm better. I don't even know why I was ever put on those things. And, that's the unfortunate thing of, and again, I don't like to badmouth traditional medicine because I don't think anyone goes into medicine thinking I'm going to do a mediocre job and I'm going to have all my patients be frustrated because they didn't feel listened to. But the system in itself has trained providers, trained patients that, every part of every system is compartmentalized, and, I always say we learn really early in the song we were taught, the ankle bone's connected to the, we're just one body and you can't compartmentalize. Everything works together. Every drug works with or against another drug, with or against your genetics. And I mean, you and I both know, regardless of our background, that is not the way we were educated on how to treat patients in traditional medicine. It's a matter of everyone has their specialty and every person's going to, manage their issue. And, then patients, by now they know that they're caught in a system in which nobody is actually looking at the entire picture and digging for the root cause, which is how somebody like the patient you're talking about has 15 diagnoses. And, the textbook definition of constipation is not pooping for 7 days. I mean, which again, if anyone actually has that problem, they're miserable. And so, again, that's just the way traditional medicine focuses, and it leaves patients like her desperate for help. So.
Yeah. And you know what happened when she told somebody she hadn't pooped in 7 days? They gave her Miralax and they gave her a stool softener and they gave her all these medicines. And I was like, well, did anyone talk to you about how much water you drink, how much fiber you eat, how much? And she's like, no. And I'm like, okay, well, how are those medicines treating you? And she's like, well, they don't really work, but then every now and then I have explosive diarrhea. And I'm like, perfect. So we have done nothing to fix you. We have given you more medicine and another problem. Like, so
antispasmodic to that list. Yeah.
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 So and I say this all the time, like, I don't know what happened in medicine where we just, we forgot how to like use our brains. Right. And I think that's why it's so difficult. Like, I'm training a nurse practitioner and a PA. I know that you were recently training a provider, and it's like, there's not like, a lot of times people want to, if A plus B, then C. And I'm like, that's not how it works. Like, you have to listen, you have to take everything into account, you have to use your brain. It's hard work. And to that point, like, you can't see a patient in 10 minutes either, right? Like, you can't. And so unfortunately, a lot of primary care doctors, that's why they do such a mediocre job at best, because you come in complaining, you have verbal diarrhea of 10 symptoms. In their heart, they want to help you. They're like, God, I really want to make you better. They don't have time to like deduce and talk to you about your lifestyle. And so they think, okay, well, what drug is going to take care of 7 out of the 10 symptoms? And then they hand it to you without thinking about, okay, well, then that's also going to cause X, Y, and Z, So I think that, and then you just get in this, you come back 3 months later and this symptom is better, but this one isn't. And you're crying again, or you're upset again. And so then you get a different drug, and nobody ever steps back and, like you said, goes, oh my God, you're on 10 medicines and all of these cause you to have hot flashes, or you're not pooping for a week. Like, maybe we should think about why, because obviously if you're not pooping, people, you're not detoxing. So you detox your body in a couple ways. One of them is poop. One of them is sweat. So if you're not sweating because you're not exercising for whatever reason, you just don't want to, or you're hurting, and you're not pooping, you're in a world of trouble.
Yeah, exactly. Yeah, I tell patients that all the time, that there's 2 reasons people who exercise regularly are so much healthier than everyone else. And the first one is that they sweat.
Yeah.
Because you have to sweat, you have to poop, you have to make plenty of urine in order to detox your body. And your body's actually made, I always say, our bodies are made so smart. They want to fix their own problems. And that's actually part of why we get autoimmune disease. It's that everything in our environment and the food that we eat and, our lack of sleep and all these other toxins that our bodies were not made to handle, our bodies are trying to handle, which is, how we both are so busy doing what we do. And again, that whole conversation about, the traditional medicine, that could be a whole series of podcasts. But part of it's too is patients understanding their own accountability. When people come to me and say, oh, you fixed my friend and she's these things, I'm like, well, did your friend tell you that I just gave her the tools that she needed and she did literally everything herself? Because it does take a lot of work to get back. I always tell patients, if you come to me and you're over here on the health spectrum and I need you over here, actually I need to get you here, so that we have a little bit of wiggle room for when you want to have that occasional cheat meal or, whatever it is you want to do. And that takes a lot of work and a lot of education on our part and their part. But it's worth it.
Yeah. And that's why I started this podcast. And that's why I do all my online stuff, is just because the lack of education I found was just frustrating, right? Like, people come to you and they do want to get better. But like you said, in order to get better, like, I can coach you, I can give you the tools, but you have to do all the work. Like, every bit of it. I can't follow you around. I'm not your mom. I'm not your nanny. I don't want to be. I want to give you the tools, and I want you to make little lifestyle changes. And then over time, those things build up, right? So consistent habits will change. Yep. And you didn't get unhealthy overnight. You're not going to get healthy overnight, but you need somebody to be in your corner to at least give you the information you need, right? Like, here are I call them your ailments. When people come back to see me for their 2-week lab follow-up, I'm like, okay, are you ready? There's 15 of them. Here we go. but that's what you need to know, all of that, because it all works together. So you can figure out, okay, what do I need to do to start making this better? And that's kind of how it is, like the human body, right? I tell people, like, you're okay until you're not. Like, your body is so resilient, like, it's going to fight all the bad choices you make. It's going to fight all of them. You drink too much, you eat too much, you don't sleep enough, you're stressed out. All the terrible choices you make, your body is going to fight until it can't. And then it's like there's this tipping point, and you go from completely healthy to not. And usually you have a lot of things going on at that point because your body has done all these things to try to keep you healthy. And then all of a sudden it's not. And when your gut's not right, I've just learned this recently, then you're in really bad shape because not only are you not detoxing, you're not absorbing your micronutrients. 70% or 80% of your immune system is in your gut. Your immune system goes crazy. It's just a really big mess. And a lot of people are insulting their body 3 times a day because they're putting terrible food in their body, right? Or they're drinking terrible things. And it's like just little changes like that, you would be shocked what it does to your body.
Mm-hmm. Well, that's what I tell patients so that because, I feel like I say, when I explain this to you, how you got sick, you're going to be like, well, that's common sense. Because it actually is common sense. It's just not understanding. I tell everyone, you're born with a toxic burden bucket, which obviously you don't come out of your mother's womb with a bucket, but the size of that bucket is determined by your genetics. So your genetics, if they're horrible and everyone in your family history has autoimmune disease or, early onset cancers, you might be in trouble. But the size of your bucket's predetermined, but the things that go in your bucket are diet, infection, parasites, environmental toxins, lead in your water, chemicals in your environment, things that you don't necessarily know you're being exposed to. And then the things that you do know, if you're stressed out, if your sleep is poor, if your diet's poor, and eventually your bucket will spring a leak. And so we think, well, how did this happen? I've been healthy for this many years. Well, actually your body is very resilient. It was working very, very hard to keep you from getting sick. You just weren't listening to those signals, the poor sleep, the anxiety attacks, the cravings, whatever it is that your body was saying, hey, I'm overwhelmed. And now you've sprung a leak, and that leak is going to be a disease or a symptom or whatever the case is. And so, my whole focus with helping people is to take the things out of the bucket that they can control, which is their diet, their sleep patterns, their stress level. And I'm going to find the things in the bucket that are filling it up. The parasites, the heavy metals, the mold in their home, those things. And so that we can get their bucket empty enough that their body can start fixing its own problems again. And that's the solution really to most every disease, regardless of what it is. Cancer, some of these things are a lot more complicated than that. But for the most part, most diseases we treat in medicine, that's the approach to fixing them, regardless of symptom or name.
Yeah, I agree. Just get rid of the toxins and let your body heal itself, because our body was made to heal itself if you'll give it what it needs: nutrition, sleep, make sure that it has the things it needs to make ATP, which is energy. Get rid of the toxins. Then your body is a miraculous thing, but it's just we aren't educated on how to do that. And they're terrible to providers, right? Like when you go to school, the first thing they teach you is how to not be nice to yourself. So I've been talking to a couple medical students recently because one of them wants to come shadow me. And then one of them worked for me 2 years ago and is in med school right now. And is texting me about, I just started my rotations and I have to be there so early and I have to be there so late and I don't get to eat lunch. And they teach you from like infancy as a provider how to not be nice to yourself, right? How to not sleep, how to eat, not eat at all. And so it's just crazy. Like the whole education system around medicine is just, it doesn't make sense.
It's completely focused on not treating your body like the temple that it actually is, whether it's yours or your patient's, that if you take care of it, it should take care of you. That's pretty simple.
And why do you think, there's lots of theories, but I want to know your theory. Why do you think that insurance companies are so like against functional medicine and what we do? Like, why do insurance companies not pay for stool studies? Why do they not want to, do organic acid testing? Why do they think, ozone is crazy, peptides? Like, what is your thoughts on all of that?
Oh, okay. I won't go down the whole rabbit hole there. I think that's two things. I think, one, obviously I'm a functional medicine provider. I think insurance is for the most part a racket. I compare insurance companies in healthcare to casinos. We're not building more casinos by paying out. So the people who are, because we live in Oklahoma here, so the people who are funding the system are the healthy ones. And the people who are pulling from it are the ones who aren't. And so if we have healthy people pursuing being healthier, right, then, and insurance companies pay for that, they're going to go broke. That's their guarantee. I don't go to the doctor, right? You probably don't go to the doctor. We're funding this system. And so they don't pay to be healthy. Now, I also believe, kind of going into this whole weight loss craze, I do think that we have to focus too on it's not all the system and it's not all the doctors, patient accountability. Why do patients, this whole with the peptides, with the GLP-1s, how many people on weight loss drugs change anything? Most of them don't, right? And so I can understand an insurance company saying, we want to see that if we're going to spend this much money on your health, then you're going to have to put in this much investment. However, that is not the way they approach a super unhealthy people. So if I was going to say, because a super unhealthy person who smokes 2 packs a day and is 150 pounds overweight has no problem getting their hospitalizations, their quadruple bypass, their amputation, whatever covered, but getting a supplement paid for, a stool test is not covered. And that comes down to guideline-driven traditional medicine, that A plus B equals C, and anything outside of that we're not going to address. And so I think it comes down to not wanting to fund things, not wanting to get people better. That's not the insurance company's focus. Cannot possibly be getting people healthy. That would be a bad business model. If their job was to get people healthy, they would be broke. So that in the nutshell is the summary. And so they're not going to pay for healthy people to stay healthy. So the insurance system is made for people who are sick only. And the people who have to fund it, or they would go bankrupt. It's a business, are you and I. So I could go into, I always say when I run for president, my goal is to fix that system. And really, the system is driven by fear, right? Everyone's afraid something bad's going to happen. And so we pay for insurance that doesn't cover staying healthy. So it only pays when something bad happens.
Do you like what you've heard so far? If so, Modern Endocrine is now able to provide telehealth services in 8 states, including Arizona, Nevada, Oklahoma, Texas, Ohio, Illinois, Michigan, and Georgia. If you would like to become a patient, visit our website at www.modern-endocrine.com/contact. You can also email us at hello@modern-endocrine.com or call our office at 405-286-1571 to schedule an appointment. Please note, we no longer accept insurance for new patients. However, we do have customizable membership programs available. Your first visit will include a detailed intake, and lab orders will be provided to further assist us in developing your 10 stages to ultimate health plan. We do offer discounted lab rates with a nationwide lab service. And now back to the show.
But
yeah, I think you nailed it on the head. I think that insurance companies want to focus on keeping people sick because then that's how they stay in business. And it's really unfortunate because, we could make everyone well, and then the country would be so much more successful. And, it is the healthy people and the healthy taxpayers who are funding all the sick people. But the sick people are also I feel bad for those people, they're losing time with their loved ones. They don't want to be sick. They just aren't educated, or they don't, they get stuck in the system and they do what doctors tell them to do because they believe in doctors and we went to school, but we're not doing those people a service. That's what got me so upset when I worked at Mercy Hospital. And when I was I've got to get out of this rat race, because it's the sicker people got, the more sick we made them, right? It was just they came in and they were sick, and in my heart, all I wanted to do was make them better. But it's you're to the point now where they tell me I have to give you another medication, right? I got a stack this big on my desk today of stuff from Aetna and Blue Cross and all the things, because it's the time of the month, people, where Aetna says, "Dear Dr. Smith, you are taking care of Linda Sue, and she is not on the following medications: an ACE inhibitor, an aspirin." There's a list of 5 medicines Linda Sue isn't on because I don't want to put Linda Sue on those damn medicines. I'm her doctor. But guidelines say that Linda Sue needs to be on those medicines. I had a stack of 50 of them on my desk today, and I'm it just infuriates me. You're not a doctor. Don't tell me how to practice medicine. I know Linda Sue's not on those medicines because I don't want her having potassium issues or leg cramps or, it's frustrating. And so it's the sicker people get, the more they try to push you or scare you into, putting them on more medicine. Just like these letters I get, Bob Smith has chronic kidney disease, stage 3, Dr. Smith. And he also has diabetes, and he's also on insulin, and he also has heart disease. Why is he not on a beta blocker? Why is he not on an ACE inhibitor? Why is he not on, and it's because he's already on 20 medicines and we're trying to get him off of them. And he's dizzy when he stands up. So he doesn't want a damn beta blocker. And oh, by the way, he doesn't want to have ED either. So, it's frustrating. Like,
Well, but also
so
then there's the
frustrating.
section about Bob Smith, who's not a diabetic, who's 200 pounds overweight, who has all those things. And then we say, hey, we'd like to give him a GLP-1 to help him lose the 200 pounds and fix his kidney problems and his heart problems. And they say, oh, we're not going to cover that drug because he's not a diabetic. It's a racket. I mean, it's just what it comes down to. It's not about patient outcomes. But then again, there's so many things. Again, it's you want to get rid of a patient's cancer, and then you do. And now it's like, well, for the rest of their lives, we're going to make sure they're miserable. Right? We're going to make sure that their cancer doesn't come back, and we're going to give them this drug for the next 10 years that's going to make them miserable. And they're probably going to have a stroke, or they're probably going to have a heart attack, or they're going to get a divorce or whatever, but that's not our problem. That's just the way. I mean, and again, I always tell patients or students when they come and they're like, oh my gosh, traditional medicine, it's, like, why would you do things this way? And like, I say, it's important that you do know those guidelines and that you do understand the purpose, because traditional medicine is not all bad. It is made for sick people. It is made for sick people who are not going to listen. I mean, that's essentially, or it's made for people who something really bad happens, right? I mean, I don't want, obviously there's people who have a stroke, have a heart attack, have cancer, have a car accident, whatever the case is, have a congenital condition. And that's where traditional medicine does have to, play a role. But the system is made taking into consideration basically that patients don't have any desire to get better, and that we are just managing symptoms with medication. And that will lead to more and more and more with no intervention of just common sense and attempting to be healthy.
Yeah, and I'm okay with traditional medicine, but what I'm not okay with is whenever I send a patient away with a plan that's maybe not traditional medicine, it's more functional based. And I'm okay with it being incorporated into the traditional plan that they have, just trying to educate them and help them understand, hey, we need to drink more water, we need to eat more fiber, these are supplements that may help. And then I get these patients that come back to me and say, well, my primary care doctor, my traditional oncologist, my traditional cardiologist said that you're crazy. And it's like, okay, well, maybe, but what I say to that is, let's take a look at your traditional oncologist or your traditional primary care doctor or your traditional oncologist. Look at them and tell me if you would like to be them, because I try to practice what I preach, and I think I'm pretty healthy. I try to stay healthy. And so that also infuriates me when a 300-pound cardiologist or a 300-pound oncologist is giving somebody advice and telling them that my advice is irrational. I would like to just, it drives me crazy, right? Like, it's like, well, they obviously know what they're talking about. They're 300 pounds. Like,
well, one of my rotations in school, which is actually one of the things that really, and I try to be PC, but ultimately I was in a rotation, and the physician was very smart, but he was very heavy, and he had already had gastric bypass. Now, none of his patients knew that. And we would have these women come in and they would complain, cry, like, I just can't lose weight. I'm so overweight. I need help. And he would literally say, yeah, all of your problems are because you're fat. You just need to put your fork down. And one, I can't believe he never got punched in the face. But two, I was like, oh my God. And I finally said, I'm sorry. Do you think you're doing these women any service? Like, you don't think that they look in the mirror? Like, we're women. They look in the mirror and they see everything wrong with them. And then they come to you vulnerable and ask you for help. Have you ever thought about saying, hey, you know what? I'm addicted to food too. I'm so addicted to food that as a physician, I have actually had surgery to try to make me keep my mouth shut. And clearly it's not working. So let me help you with that problem, because sometimes it's genetic and sometimes you just need education. And maybe if I teach you what causes diabetes, you'll be more inclined to change what you eat. And he looked at me like I had three heads and said, nobody wants to listen to any of that. And I
but
said,
they do. They do. I think patients want to know that we're human. Like, I put all the stupid stuff that I do on social media. I don't care. Everyone knows I love peanut butter and chocolate. I have if you locked me in a room with peanut butter and chocolate and left me for 30 days, I would come out 20 pounds heavier. Like, I'm sorry, like, it's just going to happen. Yeah. But if you give me some good fat, like some avocado and some olive oil and some protein, I can, eat that before I go to the chocolate and peanut butter, it's educating yourself and knowing like your issues, but we're all human and we all have our downfalls. Mm-hmm. Nobody's perfect, but it's just learning like how to take the genes that you have, the food that you love, all the things you want to do, and make it work with your body. Right. And you're right. Like, we are women, but most people are like you're the worst on yourself, right? You look in the mirror and you say all these terrible things to yourself. And I've really worked on that the last 5 years. I love Mel Robbins. She's all about like, you know, you don't say anything to yourself that you wouldn't say to somebody else. And so I'll catch myself doing that sometimes. Like just the other day, I caught myself looking in the mirror at my eyes because Erin's going to help me fix my eyes, you guys. She's going to do this fat graft thing we're going to talk to you about under my eyes. But I look in the mirror and I'm like, God, you look so tired. Your eyes look terrible. And then I'm like, wait a minute, stop. That's not helpful. You're just, you know, you've lost the fat pads under your eyes because genetics, like my mom had the same thing. And so people are very hard on themselves, but we shouldn't be. Like we should never talk to ourselves how we wouldn't talk to somebody else because again, that causes stress, right? When I'm talking crap about myself looking in the mirror, my body is like, you know, all revved up. Like my cortisol goes up, my insulin goes up. And it's like, why would you do that? I wouldn't walk up to you, Erin, and be like, man, your eyes look like shit. You need to put fat under your eye. You know, like I wouldn't say that to you.
I would appreciate it.
What?
I said I would appreciate it if you did though.
Yeah, no, I wouldn't. I would never say that to anyone. So it's like, why would you look in the mirror and think that about yourself? You know? So it's, yeah.
It's crazy. But yeah, and that's like, you know, I always say like, and this has kind of been in the evolution of my practice as far as, you know, I tell people, because some people come in and they're afraid. They're like, you told my friend she had to go gluten-free. Oh, you had told my friend she has to stop doing this, you know? And, you know, one thing I have learned is, you know, I think this is in general in life, you know, you meet people where they're at. And that's why I say, I'm like, the functional medicine approach to treating any condition, that's a huge component of it. It's like you said, we are a complicated web of genetics and environment and coping mechanisms from childhood and all our traumas, all the things that we are as humans and that traditional medicine doesn't take the time to appreciate. You know, the best piece of advice I ever got from anyone in my training came from a colorectal surgeon who to this day is still one of the smartest, most amazing people I know. And he said, if you listen to people long enough, they will tell you exactly what's wrong with them. And I don't think I fully appreciated then what he was saying because, you know, that's before I even started studying functional medicine. But people tell you, and sometimes, you know, with hormones, I learned this, you know, the hard way in hormones, you know, especially, you know, with pellets are consistent in their delivery if you're using a good company. And I would have people come in and be like, I feel horrible and my libido is bad and I'm gaining weight and my hormones must be off. And then I would draw labs and I would be like, oh, your labs look perfect, you know? And then, you know, 3 conversations later, I'd be like, oh, so your marriage isn't doing well and you hate your job and you recently went through financial troubles and now you're drinking more alcohol and your sleep is poor, you know, and, you know, sometimes it's just having that conversation about, you know, all of these things, your cortisol is a hormone, your insulin is a hormone, you know, all of these hormones work together. And this is why all of these things are so important. And just making people realize that your body is a complex system. And sometimes the solution isn't an organic acid test or a stool test. Sometimes the solution is just eating more fiber, drinking more water, and getting good sleep. And, you know, I think it's just a matter of taking the time to, again, listen to people and then meet them. Not everybody's going to do a stool test. Not everybody's going to go gluten-free. Not everybody's, you know, wants to get that complicated. And just helping people the best that you can in the way that they're willing to change makes it a little less scary.
I completely agree. You got to meet people where they are 100%. And I say this a lot. I know you think this, but like part of being a doctor now, if you're going to be a good doctor and especially a functional medicine doctor, sometimes I feel like I'm a therapist and that's okay. I mean, sometimes people just need to, I saw somebody either yesterday or Friday, I can't remember now, but they literally just like went off for like 15 minutes. I didn't even say anything. I'm just sitting there like listening. And then when they're done, I'm like, okay, so it sounds like everything I was helping you with is probably better, but it sounds like your marriage is not great. It sounds like your husband is making you angry. It sounds like, you know, these are the things you need to communicate better with. Do you have a therapist? You know, like, sounds like maybe you need a therapist. And that's okay because sometimes, especially as women, we like keep it all in, right? And then we just implode. Like that happens because we feel overwhelmed and we take care of everyone else and we don't take care of ourselves. And sometimes it comes out. And so I think that's, you know, traditional medicine, you know what would happen in traditional medicine? She would have gotten an SSRI and probably like some Xanax and all these things. And then she would have had worse symptoms. All she really needed to do was tell me how pissed off she was at her husband, get it all out. And then, you know, she probably was fine after that. I was like, it sounds like you need to go home and, you know, tell him this and this and this. And then you might need to get a therapist too. She didn't need anything from me.
For that.
Yeah. I mean, you know. But
Don't blame
that's
me for what happened.
okay, because we all have those. I mean, everyone has those times, right? We all have those times where we're overwhelmed, and sometimes it just, but you have to be able to, like, like you said, you have to be able to meet people where they are. That person, if I would have went at her like, oh yeah, you feel terrible and you're tired, let's do a stool test, let's do this, she would have been like, no, like, yeah, her
Yeah.
mind would have blown because she was just angry. So yeah,
Well,
it's,
yeah, well, that's what like in the basics of functional medicine, depending on your school of thought and who you're training, and often even in my practice, you forget this. Spirituality, what you believe in, how you manage stress, is a huge part of that. I mean, when you're talking about 70% of your immune system is the gut, there is a traditional medicine proven axis between your gut and your brain. You can get a leaky gut just from being stressed out. Right? Stress is as big of a risk factor for a disease as smoking. I mean, we have proven all of this, yet we poorly address it in medicine. And so, yeah, sometimes, I mean, I say that all the time. Like, sometimes I'm just a glorified therapist, but also making people understand what happens when cortisol goes up, what happens whenever your, dopamine is too low, or whenever your serotonin is too low, and how those things, affect. And, this is where I will say again, like, sometimes, meeting people where they're at, sometimes, for me, at least in my practice, the answer is Zoloft temporarily. Why? Because the person doesn't have the money to do things the way, it's complicated. But my job, I always say, is to educate you. This is everything that's happening. And if we have to use this is what it's also going to cause. So let's make a deal. If this is what you can do right now, then in 6 weeks or 8 weeks, we're going to come back to this and we're going to do things my way. Because nobody, regardless of what's going on, stress-wise, budget-wise, wants to be on a drug for any period of time that they don't have to, or at least nobody who comes into my practice, because obviously that's why people are coming here, which, makes it much less difficult and much more difficult for us in so many ways. So
yeah, no, I completely agree. I like that. Like, sometimes you do have to use medicine, and that's okay. You just need a plan.
you
Like,
need to
this
plan.
medicine is needed. It's short term. This is our plan to get off of it. And, and if you're somebody who comes to me and says, nope, I just want a medicine and I don't want to change anything about my life and I'm going to be on it long term, I'm like you. I'm like, there are 99 doctors in Oklahoma City that will give you that. There's the door. Like, it's not me.
Right.
Like, I can, but that's not where my heart is. Like, that's not what I love. That's not what I want for you. I appreciate you, but there are 99 other people who don't want that, who are waiting to see me. So go to somebody else who will just give you that.
That's what I say. I'm like, the reason I don't do these things here is not because I can't. It's because, again, people will ask me, like, one of the number one questions people will say, well, why does my other doctor not do this? And I try not to badmouth. Now, again, I tend to be somebody who puts an article in the mail when someone's cardiologist doesn't like me or whatever the case is, or I say, you know what, just go back when you're better and ask them how they feel about your labs now. I try not to, get in that mix. But, I say traditional medicine is driven for complaints, right? Complaints that you don't have any desire to fix on your own, or you don't know how, and we're going to take a medicine. So if you can get what you're asking me for from anyone else, then I'm not going to do those things, because what you can't get from anyone else is what you're going to get here, and I can't do all of it. And people are like, oh, well, that makes sense. So I'm like, no, I'm not going to. You're not going to come to me for your strep throat or just to manage your blood pressure. Now, if I'm going to manage your blood pressure, I'm going to check your genetics for an MTHFR mutation, and I may even check you for heavy metals, and I'm going to recommend all of these other things to solve it. But obviously, I'm not going to take you off of your lisinopril until it's solved, and you have to do all this work. And then that person, like you said, who doesn't want to do that, I'm like, well, then go back to your primary care doctor and get a year's worth.
Yeah. Yeah, because you have a choice in life, and that's okay. Some people aren't ready, like you said. Some people are just overwhelmed, and that's not what they want. But I think, you have a choice in life, and you're either choosing to fix things now, and so that you can have a prolonged, productive life later, right? Or you're choosing to not, and know that you're going to spend the end of your life really sick.
Right.
So and I tell people that a lot of times. They're like, well, this costs money. It costs money to take supplements. It costs money do you know how much money it's going to cost you when you're 80 and on dialysis and have heart disease? I mean, your medicine's going to cost you $2,500 a month, even after Medicare pays for it. So it's just, I mean, you have a choice, and it's just, we have not educated people, I don't think, well, on the ramifications of their poor choices, nor have we educated people on just what good, healthy lifestyle choices are, right? We just, hey, go, 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 go. Sleep doesn't matter. You can sleep when you're dead. Eat what you want. Stress doesn't matter. I mean, we are terrible at the way that we educate people in this country, and even kids. So that's my 2 cents.
Well, like you said, I mean, it's just a matter. I say my job is to educate you, so to the point that at some point you don't ever need to see me again as long as I fixed you. That is my ultimate goal, which is not usually the goal in medicine. And that if you come back, you're going to come back and say, I know I didn't do X, Y, and Z, and that's why I'm here, and I need you to reset me again. And that's when my job is done. And what you choose to do with that information is up to you.
Yep, I agree. Amen. I want people to get better and not to come back unless you just want to come use one of the services we have, the red light bed, or you want to do yearly blood work or whatever. But like, I don't want to see you every 2 months. I don't want to see you every 3 months. I don't want to see you every 6 months. I don't want you to need to see me. It's not that I don't like you. It's not that, I want you to get better. Like, who wants to spend their life at a doctor's office? Like,
yes, exactly.
Okay, so I want to transition quickly to a couple, because there's 2 more things I want to talk about. I want to ask you about hormones briefly. People loved, I had an interview with Dr. Pete. I think it was episode 17, and people loved Dr. Pete. Dr. Pete, but they loved the bioidentical hormone stuff. And so what is your take on, I know you've done pellet therapy for a long time. I'm a fan of pellet therapy as well. I think, Dr. Pete said it very well. You have to have the right hormone in the right dose and the right delivery mechanism to make sure that you're doing well with hormones. But tell everyone, the number 1, number 2 questions we get, don't hormones cause cancer? So what is your take on, do hormones cause cancer?
There is no science that proves that at all. So here's what I tell people about that. And of course, I still get those questions from people who've been on pellets for 10 years and like, well, my friend just said, what causes cancer is a combination of genetics and environmental exposures. And that's a much more in-depth conversation, but that is what causes it. Now, once it's happened, obviously, we do know that hormones can feed a cancer. That we know that that breast cancer can be driven by estrogen or driven by progesterone, but not caused by it. Studies show that that's not the case. And there's actually been studies who show that whenever a woman who's already had cancer is given hormones, her risk of recurrence is lower. So the science doesn't support this belief, which we've already established that was one of the most misinterpreted studies ever. So when people come to me and I'm very blunt and they're like, well, I don't know that I want to take estrogen and I've heard it causes cancer. I'm like, oh, well, the Dr. Pepper that you just brought in here and the 50 pounds that you need to lose, that's what's going to cause cancer. I mean, we know obesity is one of the biggest possible risk factors you can have for cancer. But that's what's funny. You're in your gynecologist office and they're, I would say that happens less, or your primary care or whoever, and they're telling you, oh, you should be careful about estrogen. They're not addressing your weight problem or your diet problem. And so hormones don't cause cancer. You do have to screen each individual patient, make sure, again, in my office, I've traveled the country and spoken for Myriad Genetics about the BRCA gene and Lynch syndrome. So I'm very well educated on cancer risk and hereditary cancer and screening and guidelines, but I read all of the science, not just some of it. And I have lots of BRCA positive patients in my practice who trust me because they know what I know, and to take hormones. So that fear, again, I always say, go read the study yourself. It's out there. It said that the women who took estrogen didn't have a higher risk for cancer. Synthetic progestin causes cancer. And this is where, again, a lot of the people telling you not to take hormones are the ones prescribing birth control like candy. So
yeah.
Yes.
Birth control, my least favorite drug behind statins.
Yeah.
Okay. So there you have it, people. I'm not crazy. Dr. Pete, now you have Erin. I'll have some other people. I'm actually doing a bioidentical hormone summit that will come out in February or April next year. I can't decide which one, but we'll have lots of talks about this. So there is Erin's take on hormones, and I completely agree. Obesity is the biggest risk factor for cancer, and then it's what you're doing to your environmental exposure. So, you women who, and I'm not knocking it, but you women who drink a half a bottle of wine at night or a bottle of wine at night every single night, I was that woman for a long time. You doing that are increasing your risk of cancer far more than my pellet or any hormone that I'm going to give you. So there are things you're doing to yourself that increase cancer, like you said, much more. The food you're eating, the fact that you're not exercising, the fact that you allow yourself to have extra, adipose tissue, those things are going to increase your risk of cancer more than bioidentical hormone therapy. So
absolutely, way more.
Okay, so now I want to transition to tell everyone about this procedure that you're going to start doing. So people with autoimmune disease, anyone who has autoimmune disease, Erin and I are very passionate about this. You probably should not be putting filler anywhere in your face or your body for that matter, but definitely not in your face, because at any point in time, if you have autoimmune disease and you put a filler in your face, your body can attack it, correct? And so Erin is very passionate about helping people feel better with autoimmune disease. And so she's going to explain to you why we shouldn't put filler in our face, and then something that she can do in Oklahoma City if you're interested.
So in my practice, Cassie's practice, we are heavily autoimmune, but in my practice, we also do a lot of aesthetics. And again, you can have the most healthy person come in and, after they feel better, like, can I get Botox now? Or can I get this now? Because we want to, like I said, look as good as we feel on the inside. And my answer to that question to everyone every time is, you should proceed with caution based on your health. So, this is where I'm going to say, side note, when you're choosing where you go to get your aesthetics, you want to ensure that the person providing the service is educated on your health overall and what the implications can be if you are an autoimmune patient. Because yes, filler can last years and years and years, as we now know, in your face. And if you are a poorly controlled lupus patient, RA patient, Hashimoto's patient, then you can have filler put in your face and 6-8 months later develop a significant inflammatory reaction, which was by all means not what you were going for when you went in to look better. That is very difficult to reverse. And so here we offer two different approaches to addressing that for volume loss, and one is PRP. PRP is very popular for lots of reasons, but PRP we can just get from blood. And then I have a new procedure. The device is called Beautifill. Beautifill I bought initially primarily for my patients who wanted to have their implants removed and have fat transfer to their breast, but now utilizing it more for fat transfer to your face, because the fat one lasts a long time. It lasts up to 10 years. So it's going to last you way longer than a filler would, but it is your body's tissue. So you are not going to reject it. Meaning, you don't have the chance that you're going to be in a flare and 6 months from now, wake up looking like you got stung by a bee on your face and us not be able to fix that because what was put into your face was foreign to your body. Autoimmune disease, by definition is your body attacking itself. And so, you just want to be really careful with that. But Beautifill, like I said, we take fat, we're all women. Typically we have a place, or men, that we don't want it. And so we can take a small amount of fat from your abdomen or from your arms, and we can put it under your eyes. That's one of my favorite places to do this, because again, it looks very natural, and it is natural, and we can fill in dark skin deficits. Like I probably need to get mine done soon. And it lasts 10 years and it looks amazing, and it happens overnight, just like filler does, but with very minimal risk outside of losing a little bit of that fat if you lose weight, like you could potentially have with filler.
Yeah. So like under your eyes, where you lose those fat pads as women. And I actually learned a very interesting thing from my esthetician, Corey, this weekend. And you probably know this, but if you guys are using liner, like lash serums, I didn't know this because I'm like the queen of lash serums and I got my eyelashes taken off. That stuff breaks your fat pads down in your face, people. I didn't know this. So I'm like that person that's just, putting that stuff on my eyelash on the top and the bottom before I go to bed every night, and then putting it on the top before I go to work. And Corey's like, Cassie, that is migrating down to that little layer underneath your eye, and it's just eating your fat pads away. And I was like, huh? And he was like, yeah. And then he sends me like all these articles. I'm like, WTF. And so that's probably part of the reason why, some of it is genetic, but I have like these terrible dark circles under my eyes. And it looks like I haven't slept or I got punched in the face, but I actually sleep a lot. And so Erin has looked at them for me, and we did a little bit of PRP, but mine are pretty bad. And so we're going to put some fat under there, and I'm excited because I think a lot of it's genetic, and I've lost this fat pad under my eye, and it looks fine, but I would like it to look better.
It will look amazing. Well, that's the thing about fat. We call it liquid gold. Fat contains all the things, like I said, it's a better product than something like PRP. It's definitely much better. The whole point of filler is to put fat back where you've lost it. Volume loss, some of it's bone with age, but most of it is related to fat. So when you inject fat under your eye or in your cheek or in your lips or wherever you can inject it in your rear end, I don't do that here. You can inject it in an area where you lost elasticity in your thighs. It is going to help you regenerate collagen. It's going to change the tissue. If I could show you pictures of somebody I just did 2 days ago, her eyes look like she's 30 years younger, literally that fast. So you're going to get a better result, and it's going to be longer lasting, and there's, going to be zero risk of your body rejecting it.
Yeah. So if you have autoimmune disease and you are interested in this, I'm going to link Erin's stuff on the show notes. So Encompass Wellness, I'll make sure that we link her Instagram and her website. And so you can get a hold of her, but I'm super excited. And then when she does mine, we'll post pictures because, I don't care. I'm fine with you all knowing all my business. It's totally fine. I do, post without makeup and all the things. So that's exciting though, because when she told me about that, I've had a lot of people tell me I need to put filler under my eyes. I've had a ton of people, I've had consultations with people and they're just like, you have really dark circles, you have no fat mass, you need filler. And I have been like, no, because I've seen patients have terrible issues with filler under their eyes. It migrates, it does. And I just don't feel like dealing with that. So I'm really excited that Erin's doing this and offering this in Oklahoma City. So I'm going to have it done soon. And then we will post some before and after pictures. So I end my podcast with 3 questions. Everyone gets the same 3 questions. They're easy and they're just to kind of help people learn. And so I'm going to ask you these questions while we kind of wrap up. So what is one food that you would consider is most beneficial and why?
Oh, I'm sure you get this. It's going to be broccoli.
Broccoli?
Without going deep into the science, because of the detoxification of what it does for your body, it is, there's probably 3 or 4, but broccoli, if you were going to say, what's the one food I could eat to try to work on getting rid of the toxins that I've accumulated in my body, it would be broccoli.
Okay. So broccoli, I don't know that I've gotten broccoli. I get a lot of eggs and blueberries, but I do love broccoli. I agree with you. It's on my 10 superfood list. I try to eat it every day or at least every other day. What is one health tip that anyone can do that's free?
Oh, I've got lots of those. Exercise is one where people are always like, that's a thing. I can't go. I don't have the money. And I always say, if you can do 15 sit-ups, 15 push-ups, 15 lunges and 15 squats a day, it will change your life, because eventually it will lead to more. But when you look at the number one predictor of how long you will live a healthy life, it is your muscle mass. It doesn't cost anything and it takes 15 minutes. Start there and go from there.
I like that. So 15 push-ups, 15 setups, 15 lunges, 15 squats. Mm-hmm. And if you really want to get a gold star, do that like 4 times. So work through that 4 times. All you need is, a 6-foot area on the floor. It doesn't cost you any time. You can do it whenever you want. And I completely agree. It is mesmerizing the number of people that can't do a push-up or can't do, body weight squats. It's actually kind of sad.
One thing about it is if you do it at home, it's that whole, first of all, nobody's looking at you. When you go to the gym, nobody's looking at you. Everyone's looking at themselves thinking they look stupid. But if you're doing it at home and you can't do more than 2 push-ups, that's fine. Set a goal of getting to 15. And then, like you said, do 4 sets of it. But start somewhere.
When I started really working out in 2020, I could do 2 push-ups. That was it. 2 real push-ups. And then I had to get on my knees. And so I did knee push-ups forever. Sometimes I still do, depending on how tired I am, but that's okay. I did 2 push-ups and then I got on my knees and I was like uber embarrassed. And then the next time I did 3, and then I don't think I could do more than 3 for like a month, but I eventually got to where I could do push-ups because I just never have had a lot of upper body strength. So that's okay. And like you said, nobody's looking at you at the gym. Like I promise, nobody cares. We're all in there just doing our own thing. So I like that. That's something you can do at home. And then the last question is, if you could change anything about your health 10 years ago, what would you have changed and why?
Oh, gosh.
Maybe for you 15, because you've kind of been in the functional medicine world for 12 years. So I'm sure you've been doing all the great things for the last 12 years. But prior to your functional medicine knowledge, let's say 15 years ago, go back 15 years. If you could go back and take back something you did, what would you take back for your health and why?
I would say food. Food had to be the biggest thing. And 15 years ago, I was, fresh, still in grad school. And, same thing. It's like you work constantly, you're studying constantly, you're driving constantly, doing all these things. And my diet was horrible. And my diet actually, even in the beginning of my functional medicine journey, it's a hard thing to change. It's very hard to change what you eat, especially whenever, I went to college for a long time, right? So, alcohol intake, eating poorly. If I would have realized the damage I was doing to myself then, I would have, like, it stresses me out now. And again, like, we both offer things that you can do to, I always say, cheat. You can cheat and undo some damage with ozone, NAD, stem cells, all of those things. But knowing the risk for cancer, knowing the risk for heart disease, that comes from what you do to yourself over and over every single day. It would definitely be a dramatic change in my diet a long time ago.
Yeah, I completely agree. I look at my body very differently, kind of like you said, kind of like a temple. I used to look at it as like, I'm 28 and bulletproof, but now I'm like, nope, not doing it. Like, and the more at peace you become with that and the more healthy you become, the more you don't want those bad things. So it's interesting.
It's like I tell patients, I'm like, you have to get to the point that you feel really good to realize that you felt really bad. And then you realize when you do those really bad things, you feel really bad and you just don't want to do them. But you have to get to that point that it's worth it. And we're, luckily for you and I, we're there. So.
Yeah. Yes, luckily. Okay. Well, Erin Files, thank you so much for coming on Back to the Basics podcast. I think that everyone will enjoy this. They love functional medicine-based stuff. And then we might have to have you back at some point to really talk about some of the organic metal or organic acid and heavy metal testing, gut health, all that stuff. But I was really excited to share with everyone this aesthetics procedure you're going to do. And so if people follow me on social media now, you'll know when all the videos and pictures start coming out, this is the person. So we'll post all the info. And if you guys want to get a hold of her, I'll have all of it on our show notes. Make sure that if you liked this, please share it with somebody. I know that you know somebody that would benefit from this information. So make sure that you share it. Also, make sure you leave us a review and then join us next week for our next episode on Back to the Basics. Have a good week. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.